Hi everyone, I'm Dr. Nikhil Pooviah, co-founder of Elly. Everyone in this Zoom will know someone whose life has been affected by a chronic disease. As an oncology physician myself, I've seen firsthand how a diagnosis like cancer can feel like a death sentence. We have developed a product that improves the quality of life of these individuals. Today, I'll show you how Elly does this and how we've been thriving during COVID-19. The pandemic has afforded us a unique opportunity. We are now living in an increasingly audio-first world, and we've seen this with the rise of podcasts and with companies like Headspace and Calm. Health systems, pharma, and insurers are actively looking for ways to support these patients, and we are confident there is an enormous audio opportunity to deliver real healthcare change. The human voice is a critical part of building relationships and having that human connection. So we've developed our iPhone app, Elly. She's a friendly persona who delivers content to users with a caring and empathetic voice, encouraging them to live healthier and happier. We're a content-driven company, and we think of Elly's content as building blocks. Each day, patients start with their daily Elly. These are short 90-second audio clips where Elly starts with a motivational story. She then discusses a condition-specific topic and then leaves patients with an inspirational message. It's a short audio clip that users can easily incorporate into their daily routine. Elly then provides meditation practices, a session in the morning to uplift users and a session in the evening to help them unwind before bed. Elly then guides users through exercise practices. Depending on their preferences and their limitations, they'll learn from instructors to heal, sustain, and conquer each day. Elly also has clinician classes where users can learn from world-renowned experts in their field who they would never normally get to meet or hear from. And then Elly's most popular content is her recommended sessions. Users can hear in-depth stories and insights from other patients who have gone through similar experiences and found ways to improve their outcomes. There's over 500 sessions across 9 different categories, ranging all the way from motivation through to symptoms. We already work with 50 contributors in this way, and these sessions are very inclusive and diverse for all of our patients. The way users receive all of this content is very sophisticated. We have a continually evolving content journey algorithm built using Elixir on our backend. Elly prescribes a unique patient journey, which is dependent on data received around each individual user. This is the main reason our users love Elly, because they develop a close relationship with the product from all of this personalization. These content journeys are not publicly known and is key to our defensible IP. Validated clinical research has been a big part of our success. Our results have shown that Elly saves $9,000 per patient per year in predictive cost savings. We have a user retention of 86%, which is 6 times higher than industry average health apps. But our best result is that Elly significantly improves all patients' quality of life on average by 10% per patient in just 30 days, something that no product or trial has ever achieved in such a short period of time. My co-founder Simon and I have experience building and scaling successful healthcare companies. Our previous Australian startups are currently valued at over $100 million. We've moved to the US to start Elly, and B2B is our bread and butter. In the past, we've signed up enterprise contracts with each of these clients. We have both key industry knowledge about decision-making processes, customer profiles, and their budgets. Since launching on the App Store 2 months ago, we've already started working with 6 reputable hospitals, including the likes of Oceana, Cedars-Sinai, and Duke. We soft launched with 800 users who have been engaged with Elly for more than 4,000 content plays. And during COVID-19, we also raised our pre-seed financing round from reputable partners like Google. We're an 18-month-old company and believe now is the time to disrupt the $4 trillion chronic disease market. Over the coming months, we'll be working with both hospitals and pharma who are looking to support their patients who are physically distancing at home. And they'll be working with us to offer Elly for a range of other chronic conditions, ailments, and use cases outside of oncology. The best way to understand and appreciate Elly is to meet her. So I encourage anyone here who's interested to download our app from the App Store. You can use the code SUH100 for a free subscription. And if you're looking to support a chronic condition, we've most likely already created a patient journey just for it. So we'd love to hear from you. Thank you everyone for your time.
Awesome. Thank you, Nick. Reminder for folks to put questions in the chat, and I can kick off with a few. I loved hearing your presentation. We love what you're doing. Have you thought about Elly leveraging connected devices in the future?
Yeah, definitely. Since Google's one of our investors, we very much have been thinking about a roadmap of how we can use two-way interactions with voice through devices like Google Assistant. We'd love to be able to connect wearable data to personalize some of that content as well, but so it's very relevant to patients. But they're just some of the ways we've been thinking about connected devices, definitely in our roadmap in the future.
Awesome. And then can you walk us a little bit through the patient experience? So when do they use Ellie and kind of what does that look like?
Yeah, we've seen some interesting use cases, Katya, of like a different type of patient that's been using Ellie. So some patients listen to Ellie first thing in the morning to feel inspired to go about their day. Some patients listen to Ellie on their way to work. Some patients listen to Ellie with their partner at the breakfast table over coffee. And then even in the hospital environment, we found patients were listening to Ellie in the waiting room, sometimes during their chemo treatments as well. So very different, kind of user experiences, but it's been really interesting to see that.
Awesome. Adriana Meza from Northwell Health, are you able to come off of mute and ask your question?
Yeah, hi. Good afternoon, everybody. I'm just wondering if this is only available for English speakers. Northwell is currently working on the digitization of our forms and our clinical forms, and we're very much focused on providing those services to non-English speakers. So I'm wondering if there's been any thought to that patient population.
Yeah, unfortunately, Ellie is only currently available for English. We're a pre-seed stage company, so we do see a future where Ellie can be delivered through different languages. But we've started to touch a little bit into like Spanish version, but it's a big undertaking, just cross-expanding. We've decided we'll focus purely on English just for starting with oncology and some of the other chronic diseases we're tailoring it to. And then over time, yeah, when we get requests, different partners that want to work with us for different languages, we'll definitely be interested to explore that.
Thank you.
Thanks, Adriana. Good context there for your question. James Alford, how about you come off mute and ask your question?
Hi there. Sorry, I'm speaking through a mask, so apologies if it's a bit blunted. Thanks for the presentation. So, quick question. Sorry, I represent GlaxoSmithKline as a background. So, interested around voice biomarkers and just understanding how, if you're looking at setting up a platform around that space and what your thoughts are.
Yeah, good question. So we haven't really workshopped enough how we can analyze the data we're capturing from voice from the user. We think of Ellie as being currently one directional push of content from Ellie to the user, similar to apps like Calm and Headspace that do that really well. But capturing different data metrics around voice, yeah, definitely I can see a future where Ellie can potentially look at doing stuff like that, but we're not a diagnostic tool, we're not a triage tool, we're literally there to be a companionship offering to what's already currently in the market in a clinical setting.
Yeah, thank you, makes sense.
Thank you. Let's see, well, we had time for a couple more. Ishani Umat, can you please come off mute and ask your question?
Yeah, hey Nick, thanks so much for taking the time. I'm just curious a little bit about some of these hospital partnerships you talked about. Could you speak a little bit more about the process there of how they're integrated with and rolling out something like Ellie?
Yeah, so we're currently working with 6 hospitals and pretty good feat in itself just doing that in 2 months since we launched. So how we've been working with those partners is, we've been doing most things virtually. So we've been printing them out physical brochures that they then hand to their patients to enroll into Ellie. How we do that is we create a unique code for those partner institutions. It's a very easy onboarding process to sign up. They can give the brochure. Sometimes the patients can do it in the waiting room. They can go home and download Ellie. So it hasn't been too much friction to onboard patients. And we've worked with some great clinical champions so far. Initially, we started with just 6 physician clinics at each of the clients because we wanted to make sure the enrollments are going smoothly. Now we're at that place 1 month into those engagements where we can start expanding outside of those clinics. But yeah, we're always looking for working with different hospital partners here. So if anyone, I know there's heaps on the call. So if you are interested to work with us, please feel free to reach out.
Great, thank you.
Time for maybe one more. Steve Kern, why don't you come off mute and ask your question?
That means I have to be technically competent. Okay, so the question I was wondering is if you're considering the opportunity to use some of the techniques and technologies around blockchain that would allow patients to ingest their clinical data from their caregivers into your platform so that they get actually that clinical outcome information as well. And then they can in turn decide if they want to share it with their providers as a bigger picture. I know that there's some of the startup health companies that are actually working in that space globally, and I'm just curious if you've thought about that approach.
I think I understood your question. Do you mind just clarifying? So you're asking if we can leverage blockchain to deliver content?
Yeah, well, no. I mean, the way people have been using blockchain so that you can tokenize your information and you as an individual can pull your personal information from a number of different providers and keep it safe and secure. So they've been leveraging that approach as a way to allow people to aggregate your data, because it's not unlikely that a chronic care patient is going to see more than a single provider. So the opportunity to then be the integrated point of all that information and connect it with your system might actually be an interesting thing to consider.
Yeah, I get it. So like for us, how we're thinking about leveraging EHR data is we want to personalize content. So if we know appointment data and we know when patients are having different appointments, we can kind of tailor content specific to that. So for oncology, which is our forte, if a patient had an upcoming chemotherapy appointment or an upcoming scan, which they were kind of anxious about, we want to take that data and personalize content related to mindfulness around fear of recurrence and things like that. So that's how we're thinking about leveraging EHR data. I don't think we'll necessarily be a medical record per se, kind of how you were describing, but we want to be a conduit between what's relevant to a patient and delivering it in a very kind of personalized way that is easy to understand. Most patients don't really understand all of their health data, so we don't want to kind of overwhelm them either.